Okay, so now I'm going to talk about special populations. I'm going to start off with asthma in cardio. So in relation to asthma, there are generally two types of asthma. There is the exercise-induced asthma, and there is the allergy-induced asthma. If you're going to be working with a client, it could be a really important thing if it's an allergy-induced asthma to work inside to reduce the risk of allergens. And what is really important with asthma is to make sure that before you start working with your client, make sure that they have their clearance from their allied health professional so that you can work with any instructions that they give and you're aware of what exercises they can and cannot do. So with someone who has asthma, always make sure that they have their medication with them or close by them at the gym, and make sure that you possibly give them a much longer warm-up and cool-down period so that their body is adjusting to what they're going to do during their program and not put into shock. Always follow how the client is feeling, so monitor how they're feeling during the session, and if they need to take a break, that's really important that they do so. So next up is hypertension and strength training. Again, it's really important that if you have a client who has hypertension, that you make sure they have clearance from their allied health professional to start exercise and that you're aware of what they can and can't do. Hypertension is essentially high blood pressure, which is caused by, or can be caused by, obesity, by lifestyle issues, issues with the liver or kidneys, or it can be hereditary. Essentially, you don't want to overexert your client. You don't want to push their cardiovascular system to the point where they can't cope. You should always follow the advice of the doctor and any recommendations. So if you're going to work with a client, to start off with, you would probably only do one set of exercises with them, with a maximum of about 10 to 12 reps, and really monitor how the client's going. When you're working with a client, don't let them use heavy weights or push themselves too hard. Maybe only use about 40 to 60% of their one rep maximum, so that you can monitor how they're going, and it's a way that you can progress the client as they get stronger and get on top of that hypertension. It's really important with clients to keep their head above their heart when training. You don't want them in a decline position, as they may faint or cause damage to their heart muscles. And it's really important not to give them heavy weights or to ask them to lift heavy weights over their head, as they could again hurt themselves. The third one I have is arthritis in resistance training. So arthritis is an inflammation of the joints. Again, if you have a client that comes to you who has arthritis, make sure that they are cleared by their allied health professional. And again, checking with them around where is the inflammation, where is the pain in their joints, what can they do, what can't they do, what are their restrictions. When you're working with someone with arthritis, make sure that the weights are not too heavy. Make sure they work with weights that are appropriate to their strength and to their condition. You may need to modify the exercise, so if you're going to be doing, say, a single arm row, which I'll be doing in the program, have it seated so that the client has less stress on the rest of their body, and they can just focus on the exercises that they're doing. Possibly try to use machines with clients who have arthritis over giving them free weights, because it reduces the risk of injury if they drop the weights, but you can also monitor how they're going, and they can do slower and more controlled exercises on the machines. And always monitor their pain levels, so checking with them and how they're going with their arthritis, and maybe checking through the RPEs, so the rate of perceived exertion, so that you're not pushing your client too hard.